Before you blame cold hands, dry skin, or simply getting older, take a closer look at your fingernails. Sometimes, one of the most visible clues about what's happening inside your body isn't your blood pressure, your pulse, or even your feet. It can be the tiny changes happening right at the ends of your fingers. And if several nails change at the same time, it may be worth discussing with your doctor. Imagine a 67-year-old man named Daniel. For years, Daniel rarely complained about anything. Then his hands started feeling unusually cold. His fingers sometimes looked pale in the morning, and one fingernail seemed to grow differently from the others. His family told him, "You're getting older. That's normal." So Daniel bought warmer gloves, changed his soaps, and started using hand cream. But months later, something else happened. When Daniel carried grocery bags, his fingers became uncomfortable much faster than before. He didn't have severe pain, and nothing dramatic happened. That's exactly why he ignored it. Some circulation problems don't announce themselves with a medical emergency. They can begin with subtle changes that are easy to dismiss as aging, dryness, or something completely harmless. An experienced neurologist or vascular specialist doesn't look at your hands only to examine the skin. Your hands can provide clues about blood flow, nerve function, temperature regulation, and tissue health. But remember one important distinction. A nail finding is a clue, not a diagnosis. Your fingernails cannot tell you exactly which disease you have. They can simply tell you when something may deserve a closer look. Your nail is made mostly of keratin, but the tissue underneath it is living tissue supplied by tiny blood vessels. Because of that, the appearance of your nail bed can be influenced by circulation, oxygen delivery, inflammation, trauma, nutrition, skin conditions, and other health problems. After 60, several of these factors may exist at the same time, especially when medications and chronic conditions are involved. So instead of asking, "What disease does this nail prove?" ask a better question. Why has this nail changed? A healthy nail bed often has some pink coloration because blood is circulating beneath the nail. But if several nail beds suddenly look unusually pale, especially when the change is new, don't automatically assume it's cosmetic. Anemia, circulation problems, lighting, and natural skin variation can all play a role. The hidden risk isn't necessarily the pale nail itself. The hidden risk is assuming you already know the reason. For example, your hands might look pale under bright bathroom lighting, but completely normal near a window. That may mean nothing. But if the nail beds consistently look unusually pale, and you're also experiencing fatigue, weakness, shortness of breath, dizziness, or reduced exercise tolerance, that's different. A safer option is not to start taking iron supplements on your own. Instead, tell your doctor about the combination of symptoms and ask whether a blood count or other appropriate testing makes sense. Now look at your fingers during cold weather. Do several fingers change color together, or does one finger repeatedly become dramatically different? Cold temperatures naturally affect circulation, but repeated color changes deserve attention. The hidden risk is assuming every color change is harmless simply because it disappears later. Someone might notice their fingertips becoming very pale, then bluish, and eventually returning to normal. That pattern can occur with conditions affecting small blood vessels and temperature regulation, including Raynaud's phenomenon. The point isn't to diagnose yourself. If it happens again, consider taking a clear photograph. Why take a photograph? Because your hands may look completely normal by the time you reach the doctor's office. A photo can give your clinician a much better description of what you're experiencing. Also pay attention to nail growth. When one nail suddenly grows much more slowly than its neighbors, becomes unusually thick, or develops a persistent structural change, it's worth asking why. Remember, poor circulation is not the only explanation. Trauma is common. Fungal infections can change nail appearance. Skin diseases can affect nails too. And certain systemic health problems can influence nail growth. Imagine someone who repeatedly injures the same thumb while working around the house. That nail may grow differently simply because the nail matrix was damaged. This is why context matters. Tell your clinician whether the change affects one nail or several, how long it's been present, and whether you remember an injury. Now consider persistent bluish discoloration. Nails can sometimes look darker in cold temperatures, but persistent blue or purple discoloration can have many possible causes, including problems involving oxygenation or circulation. If your lips, face, or multiple fingertips suddenly appear blue or gray and you're having trouble breathing, chest discomfort, confusion, severe weakness, or another alarming symptom, that's not simply a nail care issue. It's a medical problem requiring urgent attention. On the other hand, if your nails look slightly different in cold weather and return to normal after warming up, that's a very different situation. One of the most important combinations to notice is a nail change together with neurological symptoms. A nail change alone is often nonspecific. Numbness alone can have dozens of possible causes. But when a persistent nail change appears alongside new or worsening numbness, burning, tingling, weakness, or balance problems, your nervous system deserves attention. Don't focus only on what you can see on the nail. Peripheral nerves depend on adequate blood supply and a healthy metabolic environment. Problems involving diabetes, vitamin deficiencies, medication effects, nerve compression, alcohol exposure, thyroid disorders, and other conditions can produce neurological symptoms. Imagine a 70-year-old woman who notices that her nails seem different while also realizing she started dropping objects from her right hand. The nail may simply be the detail that makes her pay attention. Now look at your own hands. Do your nail beds look similar from finger to finger? Have you noticed a persistent color change, slower nail growth, or a difference between one hand and the other? And more importantly, have you noticed numbness, tingling, weakness, or unusual coldness at the same time? These questions can help you notice patterns instead of focusing on one isolated detail. Before your next appointment, take clear photographs of both hands in natural daylight. Write down when the change started, whether one or several nails are affected, whether temperature changes it, and whether you experience numbness, tingling, pain, weakness, or a recent injury. Then bring that information to your doctor. Don't request a dozen tests simply because you saw something online. Instead, describe the complete pattern and let your clinician decide which examination or testing is appropriate. The encouraging news is that many causes of nail changes are manageable. Sometimes the explanation is simple. Sometimes it's nutritional. Sometimes it's dermatological. Sometimes it involves circulation or nerves. And sometimes there is no serious underlying problem at all. The goal isn't to become frightened by every line or color change. The goal is to become observant. Think of your nails as one small piece of information rather than a diagnosis. Watch for pale nail beds, repeated color changes, unusual nail growth, persistent blue or purple discoloration, and nail changes occurring alongside numbness or weakness. None of these automatically means you have a serious disease. If this video made you look at your hands differently, share it with someone over 60 who tends to ignore small changes. And tell me in the comments, have your fingernails changed noticeably in the last few years? Remember, this video is for general education only. Nail changes have many possible causes. If you develop sudden discoloration, severe pain, weakness, breathing difficulty, or other concerning symptoms, seek appropriate medical care promptly. Never start medications or supplements based only on nail appearance.